Watchman with a hamstring, Mahoney with a hamstring, and Stanton grabbing the back of that leg. Watchman about 2/3 of the way up. Stanton finally finds his groove over this past week. The home runs start to come, and down he goes.
Okay, so sports injuries can happen at any time during a game or even practice. From information taken from the National Institute of Arthritis and Musculoskeletal and Skin Diseases, the American Medical Society for Sports Medicine, and Dr. Vanek, professor in athletic training here at ESU, I'm confident in the information that I have today. So, who in here has ever had a sports-related injury, even exercising, falling down steps, curb? Okay. So today, to preview my main points, I will be first talking about what sports injuries are and where they occur in the body. Next, I will be talking about preventative ways to prevent sports injuries from happening. And finally, I will be talking about how to treat these injuries if they do happen. First, what sports injuries are and what they involve in the body. Sports injuries can occur at any time during any practice, like I had stated. According to the National Institute of Arthritis, a sports injury refers to the kinds of injuries that most commonly occur during sports or exercise. Injuries can either be acute or chronic. An acute injury is something that happens on the spot, and a chronic injury is something that happens over time. An example of an acute injury would be a sprained ankle, torn ACL. A chronic injury could be tendonitis of an elbow of a pitcher. Some of the most common sports injuries are sprains, strains, fractures, concussions, and contusions. A strain is an injury to a muscle. A sprain is an injury to a ligament which connects bone to bone. A contusion is a bruise that occurs in the muscle, and a concussion is an injury to the head. Some of these injuries, depending on the severity, can even involve surgery. Next, preventative ways to prevent sports injuries. Exercise. Exercise is one of the best ways to prevent these from occurring, whether it is strength training, weightlifting, or cardiovascular training. These get your muscle stronger so that you are at less risk for injury. Also, a proper warm-up to get the body ready for play, and a proper cool-down. An example for this would be a dynamic warm-up, which gets the blood flowing, and a proper cool-down would be foam rolling, stretching, bring the heart rate down. Another preventative way to prevent a sports injury, especially for athletic trainers like myself, is taping and bracing. Ankle tapes, wrist tapes, knee bracing, ankle bracing, all have been shown to clinically prevent sports injuries drastically. Treatment of these injuries. Treatment of the sports injuries can include icing, ice baths, manual therapy, and rehab. The most important is the RICE method: rest, ice, compression, elevation. These all help with swelling and getting the athlete back to play. As you can see, preventing sports injuries are easy to do with proper and preventative strategies, which I have explained to you today. I talked to you about what sports injuries are, preventative ways, and treatment of these injuries. So I hope you all gain some knowledge on how to prevent these from happening if they ever occur. I'm going to end with a quote that I found that I thought was pretty cool. The more injuries you get, the smarter you get.